So people ask me all the time about ACL and MCL injuries, and so this is a model of a knee, and the knee, if I move the kneecap out of the way, we can look into the knee joint. The MCL is a ligament that runs on the outside part of the joint. The LCL is also a ligament that runs on the outside of the joint, but inside is where the ACL runs, and these sort of C-shaped pieces of gray tissue represent the menisci. The MCL is the most commonly injured ligament of the knee, but the good news is that 90+% of MCL injuries, when the MCL is injured, most of them will heal without surgery. And that's because the MCL is largely located outside the knee joint. Inside the knee joint there's oil, which is really good for viscosity and for low friction, but very poor for healing. The MCL is located outside the joint and rich in blood. So there's a good blood supply that can get to the MCL, and MCL injuries often will heal. When people tear just an isolated MCL injury, we usually put them in a hinged knee brace and put them in some physical therapy for a little bit of time, but often those will heal 6 to 8 weeks. There's always exceptions to the rules, but most MCL injuries do very well. The ACL, on the other hand, is located inside the joint, and the ACL is bathed again in what we call synovial fluid, which is we can think of as oil. Oil is good for movement and basically a frictionless lubrication surface, but bad for healing. There's not a rich blood supply, there's not oxygen, there's not nutrients to heal ACL injuries. So when people tear their ACLs, they often wind up with chronic instability or deficiency in stability of the knee. So what we have to do is drill holes through the bone, up into the joint, and pass a new tendon to create a new ACL for patients. Oftentimes we use part of their hamstring tendons or part of the middle third of the patella tendon to do that. ACL injuries, usually people wind up on crutches for 4 to 6 weeks. About half the time people tear their ACL, they can also have a meniscus injury, so we have to address that too. But ACL injuries are a long recovery. We used to say that at 6 months people could get back to sports. I would say that's now the minority of patients. It's more the 9-month, 10-month that it takes to get back to sports. If you look at pro athletes like Derrick Rose, who's an MVP of the NBA, it took him over a year to get back to playing after his ACL injury. And I use him as an example a lot because it's not as if he didn't have enough physical therapy. It's not as if he didn't get enough attention. It's just the biology of these healing take a long time. So the classic mechanism for an ACL is, as you said, non-contact. It's usually planting, turning, pivoting. Patients feel a pop in their knee. They have immediate swelling. They feel like they got shot. They go down. They can't keep playing. They tend to have a lot of swelling over the next day or two and wind up on crutches. Why are we seeing more ACLs now than maybe when I was a child and you were a child? There are people who have said that we play so much sports at a specialized age now. There's some hypothesis about that soccer players play soccer year-round and basketball players play basketball year-round. And so I think the fact that we subspecialize in sports at such an early age and we play so much of that leads us to putting ourselves at higher risk in fatigue, which can lead to injuries. A lot of times I see Little League baseball players, middle school, high school baseball players, and I say, did you take any time off? Or softball players too now. Do you take any time off? And they'll say to me, well, from Christmas to New Year's I took off, which is basically means they're throwing 50 out of 52 weeks a year. In the professional level, professional sports, the Fisher Cat players, Toronto Blue Jays, most of those pitchers, when their season ends, they're mandated to take a couple months off, 2 or 3 months off. It's interesting. I always find it interesting that at the professional level, they embrace that time off to rest and recover. But at the lower levels, we think that if we throw more, 50 weeks, 51 weeks, that it will be better and we will prevent injury. And it's really the opposite of that happening.